Hello, I'm Joy Cutrone, founder of Autoimmune Families. I'm not a doctor, nutritionist, or clinician. I'm a regular person like you. I'm an immersive and experiential learner, as well as a wellness and certified AIP coach. I've also been identified as a warrior mom because I'm passionate about advocating for the health of my children. In spring of 2014, my son became ill and within 6 months was diagnosed with a severe form of autoimmune disease, which then dominated his life for the next 2.5 years. It took me that long to navigate the conventional approach to autoimmunity, learn about and wade through the pharmaceuticals recommended, seek and find a healing-based approach, help him recover from the side effects of the prior treatments while we searched for his individual drivers, got some healing going, and then devised a manageable daily plan. I'm here because I want to spare you or the someone you love the pain that he endured during that time of trial and discovery. I'm here because through my quest for better answers for him, I've learned about a field of medicine that has been emerging onto the international health scene in recent years called functional medicine. Functional medicine was founded by doctors who want to explore the causes of chronic illness, not just treat the symptoms of it. It's an area of practice that was developed because these doctors themselves got ill and found that the conventional pharmaceutical and surgical-centric answers aren't enough. The fact that I'm here talking with you while my son is now outliving his life is testimony to the effectiveness of this approach. It took us some time to find our way. A healing-based approach to autoimmunity is definitely a process, not an event. But we can spare you some of the struggle that we experienced since we didn't know about functional medicine when we started out. Even in these past few years, we've gained greater clarity about what to do, who to work with, and what mechanisms are effective. As we progress through our own journey, people we encounter have asked me if I'm a doctor because they perceive that I'm well-informed and asking penetrating questions. I believe that this needs to be the new normal. All of us need to be asking penetrating questions. And then when we do, we need to be aware of the landscape of options so that we can hold an intelligent, exploratory conversation with all of our providers and form a plan for achieving autoimmune health that's individual to our needs. There's never been a more appropriate time for patient engagement and advocacy than in today's age of chronic illness. Living with autoimmune disease is a multifaceted journey. Taking a whole person approach helps increase overall quality of life for both patients and caregivers. Sometimes there is a need for pharmaceutical intervention, and many times you can minimize that need through dietary and lifestyle changes that help bodies heal. Everybody living with autoimmune disease deserves the benefits of a healing-based whole person approach. I've seen the difference it can make. So come along and join the conversation. Together we can speed the path of inquiry, ease the journey, and improve our mutual quality of life. Thank you and welcome.